Competence leads to confidence, confidence leads to commitment, commitment leads to excellence. The effective performance comes from competent, confidence, and excellence. I myself, Somarani Das, Associate Professor of Gorakhnath College of Nursing, Gorakhpur, Uttar Pradesh. Excellence, distinguished chairperson, special lecture, participant, and my dear students, a very happy good afternoon to all of you. We are indeed delighted to welcome you all for the second of international conference. The theme is National Knowledge System, a boon for future nursing service. At this instant, I'd like to thank Management Register Sir, Vice Chancellor Sir, our beloved Principal, Dr. D.S. Ajita Ma'am, for organizing the conference, which provide an opportunity and expert to share their thoughts and ideas on competency-based education in nursing. It is a great honor to have Chairperson Dr. Alka Saxena, Ma'am, Principal of Government College of Nursing, BRD Medical College, Gorakhpur, Uttar Pradesh. Ma'am, she is dynamic and very knowledgeable person. Welcome you, ma'am. Now, I'd like to honor, now I extend my heartiest welcome to delegates, paper presenter from various college and hospital. It is time to introduce my reporter, Ms. Nancy Mishra, clinical instructor and clinical expert, Mr. Prabhu, associate professor, and Mr. Akshay Edward, clinical instructor, to complete this session successfully. Now, let's start with intelligence session. The competency-based education in nursing. Competency is essential in nursing for professional value, high quality, cost effectiveness, and safety patient care. Competency hold values of dignity, integrity, accountability, and respect, communication, interpersonal skills, interpersonal partnership, personal, professional, growth and development, and leadership development, and also nursing practice and decision making. Now, this session will be dealt with by presentation, paper presentation. Now, I'd like to call upon Ms. Shivangi Shaini, clinical instructor of Guru Shri Gorakhnath College of Nursing for paper presentation.
Very good afternoon. A very good afternoon to all the delegates who are present over here and all the students. Myself, Shivangi Sani, clinical instructor at Guru Shri Gorakhnath College of Nursing, who are here to present the topic that is warm water foot bath therapy. So the problem statement is the assess the effectiveness of warm water foot bath therapy on reduction of pain among cancer patients in selected hospital at Gorakhpur. First one is the introduction. So, cancer is a disorder in which differentiated body cells undergo changes at molecular level, resulting in loss of normal cell regulation, characteristic, and functions. Development of cancer is an orderly process comprising stages like initiation, promotion, and progression. Causes of cancer may be genetic, radiation, chemical, or viral in nature. General signs and symptoms of cancer include unexplained like weight loss, fever, fatigue, pain, and skin changes. Next one is the need of the study. So approximately 15.5 million cancer survivors were alive in the United States in 2016, and that number is expected to increase nearly 20 million by 2026 because nearly half of cancer survivors live longer than 10 years. So the objective of this study is to assess the level of foot pain among samples. Second one is to assess the effectiveness of warm water foot bath therapy on reduction of pain among study and control group. And third objective is to determine the association between level of pain with selected demographic variables. Next one is the methodology. So here the research approach is quantitative and research design is quasi-experimental. Variables used in this study is independent variables are warm water foot bath therapy and dependent variables are cancer patients. Demographic variables under this study are age, gender, occupation, type of dietary habits, chemotherapy cycle, duration of illness and duration of treatment. Sample in this study, sample was cancer patients who are belonging in the age group between the 18 to 70 years. Sample size is 60, out of which 30 samples are in control group and 30 samples are in the experimental group. And sampling technique is non-probability convenient sampling technique was used in this study. Study setting is BRD Medical College, Gorakhpur. After that, the criteria for sample selection. So in this inclusion criteria are the patients who are willing to participate, patients who are admitted in the BRD Medical College, and patients who are fully conscious and who can communicate Hindi or English language. Exclusion criteria are those who are unconscious and the patient with which are having peripheral vascular diseases. And third one is the those who are having previous history of cancer pain. Next is the data collection technique. So in this, it is divided into the two sections, section 1 and section 2. So section 1 included the demographic variables. First one is the age, gender, occupation, type of dietary habit, chemotherapy cycle, duration of illness, and duration of treatment. And section B, it consists of the numerical pain rating scale, which is a straight line defining 11-point numerical range from 0, that is no pain, to 10, representing severe extreme pain. The participant is asked to mark pain level on the line between the end point after therapy in the study and control group. Plan for data analysis. So here we will, two statistics we will use, descriptive and inferential. So in descriptive statistics, mean, median, percentage, standard deviation was used to assess the level of pain among cancer patients. And inferential statistics, paired t-test will be carried out to assess the effectiveness of warm water foot bath therapy. And chi-square test was analyzed to post-test level of pain with the demographic variables. So the result was in the experimental group, 73.3% of the samples are having moderate pain and 26.7% are samples are having severe pain, and in control group 40% are having moderate pain and 60% of the samples are having severe pain. So here there is an association between the pretest value with the demographic variables. So as you can see in the table, like a type of diet, treatment, chemotherapy cycle, duration of illness and duration of treatment are the significant variables which is found in this study. So at last, there is a conclusion. The study was arranged to evaluate the effectiveness of warm water foot bath therapy on reduction of pain among cancer patients at BRD Medical College. So a session of warm water foot bath therapy was used to reduce the cancer patient's pain. So here it was concluded that warm water foot bath therapy is effective in reducing the pain among cancer patient samples. Thank you.
based on the patient
Yes, sir.
which who are undergoing chemotherapy, isn't it?
Yes, sir. Those who are taking treatments of chemotherapy.
It should be actually clearly mentioned that
Yes,
who
sir.
are undergoing chemotherapy. So it will be a sort of different this.
Yes, sir.
Okay.
Okay, thank you.
This I would like to ask you which pain scale you have used. How can you assess the pain? By which method?
Numerical pain rating scale we have used.
Which you have used.
Yes, ma'am.
And how much time you have taken for that?
Ma'am, 1 hour time we have taken for the session. Like before also we have assessed the pain level of the patient, and after the session we have assessed the pain level of the patient, whether it is get reduced or not.
Other factors it is not there like medicine and all.
No, ma'am. They are taking the normal routine treatment. We are just taking the patients who are in experimental group, and those who are in control group, we are not giving the session to that group.
The medicine is going on, maybe some
Yes, ma'am.
medicine, maybe. So both of the group is not taking any type of medication to reduce the pain.
So, ma'am, they can take their routine treatment. Whatever medicine they are taking, they will take. But for pain, we are assessing only warm water foot bath therapy. We are giving for the reduction of pain.
It may affect some medicine.
Yes, ma'am. Some
affect.
medicine may be affected.
And psychologically, have you assessed the patient?
Psychologically, ma'am, no.
Have you asked some support system may be there? It will also, because pain is affected by so many factors.
Yes, ma'am.
So only you can say that this only the warm therapy reduces the pain.
No, ma'am. Other therapies also there for the pain reduction. They're taking medications already there in the hospital.
Okay. Thank you.
Okay, thank you.
Control.
Yes, sir.
तब देखिए कि पेन इसको ये पेन का पेन
Okay, sir.
वही कहने का मतलब कि उसको रूल आउट करना है कि जो पेन के लिए जो दवा दिया उससे कहीं आराम पड़ गया और
Yes,
आप
sir.
सोच रहे हैं कि ये वाटर थेरेपी से हो गया, तो उसको रूल आउट करना जो है उसको मैडम वही कह रहे हैं।
Okay, okay.
कहने का मतलब वही।
Pain in foot, is you telling that this is not it's very common in
Yes, ma'am.
cancer, no?
Yes,
This is
ma'am.
not much common. Other like symptoms are much more common, like vomiting, nausea. So why you have selected this foot bath therapy, warm water?
Yes, ma'am, because for the cancer patient, those who are taking treatment, they are having so much of pain. So in case we are taking foot pain, so the patients who are having like a pelvic surgery or they're taking treatments for the chemotherapies, they will affect all their organs, or their all cell destructions will be there in the more in their all the bodies. So they can affect their foot pain also.
Which type of cancers are much there?
Mainly pelvic reasons cancer.
Pelvic
Like,
you have selected.
yes,
You have
ma'am.
specified only pelvic surgery patients.
Yes, ma'am, because they are having more pain in their foot areas.
Okay.
Yes, sir.
तो क्या उस मैकेनिज्म को अफेक्ट करता है कैंसर, और डिफरेंट टाइप ऑफ कैंसर जो होंगे वो डिफरेंट टाइप ऑफ, जैसे मैम कह रही थी तमाम सारे और सिम्टम्स होते हैं, लेकिन अगर फुट में पेन होता है तो उसके लिए पहले समझना पड़ेगा पेन मैकेनिज्म, किसी भी जगह पर पेन होता क्यों।
Yes, sir.
तो तब उससे जब कोरिलेट करेंगे तब वो होगा, और हर एक तरह के कैंसर का अलग अलग होगा। हाँ, केमोथेरेपी का साइड इफेक्ट ऑलमोस्ट सेम होता है, जैसा मैम ने कहा उसमें कि फुट में पेन होगा, ये बहुत कम जो है मेंशन हुआ है कि मतलब केमोथेरेपी से फुट में पेन होगा। तो ये सब चीजें जो है पूरा कॉम्प्रिहेंसिव स्टडी के लिए ऑल दीज थिंग्स शुड बी, पहले तो ये है कि पेन का मैकेनिज्म समझना कि पैर में अगर पेन कब होगा, पैर में जलन कब होगा, तो इसका एक मैकेनिज्म होता है, किस लिए होगा, इसलिए होगा, तो उसको डायग्नोज करते हैं।
Okay.
ओके।
Okay. Thank you, sir.
Thank you, Ms. Shivangi. It was a meaningful presentation. I hope students gain the knowledge, in-depth knowledge about your on topic, and I hope it will be helpful for the student and participant for the future to do any research project and for any future presentation. Now I'd like to introduce Chairperson Dr. Alka Saxena, Principal, Government College of Nursing, BRD Medical College, Gorakhpur, Uttar Pradesh. So you welcome you, ma'am. I am highly privileged to confirm the introduction about Dr. Alka Saxena, ma'am. So ma'am has completed her graduation in 1993 and post-graduation in medical surgical nursing in the year of 2001 and doctorate degree in 2019. Ma'am started her career as a tutor and promoted as a lecturer, associate professor, cum principal, cum research guide. At present, ma'am holds the position of principal in Government College of Nursing, BRD Medical College, Gorakhpur, Uttar Pradesh. Ma'am has more than 29 years of professional teaching and research experience. Ma'am has published books and done and published various research projects and scientific papers and research articles and published in national international journals. Ma'am has attended, organized, participated in many 50 international and 20 national conference, seminar, workshop as a resource person, speaker, as a moderator. She is an internal external examiner, paper setter, evaluator in various universities since 1996. She also has a chief investigator, PhD thesis, research evaluator, and evaluator of IGNO Lucknow Center. She is a member of various board studies, and she is the editor of Global Nursing Journal of India and Journal of Advanced Nursing Research. She is a member of TNI and Nursing Teacher Association of India. She awarded Best Nursing Teacher by Trained Nurses Association of India 2023. Now, I'd like to honor to have a special lecture, Mrs. Gayatri Jayapunnamaraj, clinical nurse educator, senior nurse specialist in maternity and child health hospital, Daman KSA. Ma'am, she is a very calm and polite person. Welcome you, ma'am.
Hello.
I'm indeed happy to introduce Mrs. Gayatri Jayapunnamaraj, clinical nurse educator. Ma'am, she has completed her graduation in the year of 2000 with first class and she completed post-graduation in the year of 2013 with distinction. Ma'am started her career as tutor, promoted as a professor cum research guide. At present, she holds the position in clinical nurse educator as senior nurse specialist in Daman KSA. She worked in Oman for 7 years and ma'am, she has more than 23 years of clinical teaching and research experience. Ma'am has attended, organized, participated in many national and international workshops, seminar, and conference. She has done and published research projects and articles in many national and international journals. She also underwent training in ISO workshop training in Malaysia. She achieved Excellence Distinction Award and attended in many certification courses. Welcome you, ma'am.
Thank you. Good morning, everybody. Good afternoon. Hope so. Here it is still morning. And can you hear me? I'm audible? Yeah. So hope you are all enjoying the session and you are getting good inputs from the conferences. I hope you are having a good time. Honorable guest on dais, respected teaching and non-teaching faculties, and all my dear students. I welcome you all for this session, and I'm more privileged and thankful for giving me this wonderful opportunity to share a session with you all. And I thank our principal, Ms. Ajita, for giving me this opportunity. So let's move on with the session. So as I have been introduced, I'm Ms. Gayatri Jayapundaraj, working as a clinical nurse educator in Dammam and Maternity Children Hospital. Today we are going to deal with the session competency-based education and nursing. So what is competency-based education in nursing? Have you heard of it? Can anybody tell me what is competency-based if you know? Anybody in the group? So just let's have a discussion. And you will be very frequently exposed once you graduate, once you move on from your institutes, this word competency. So wherever you go, there will be assessment for you. At every level, you will be having a competency assessment, and you will be hearing this word very often. You're going to hear about it. So competency-based education is one of the new emerging trend in nursing education now. And
Recording in progress.
Many educators state that in nursing education, we already have been working with the competency before without knowing that we are working with the competency. Because you know very well, the nursing program always functions based on a goal. And we always try to achieve that goal by demonstrating sufficient competency in the clinical practice and thereby passing the nursing exam. So we are already into the competency program, but now it is more it is an emerging now, and it is very well known to other people. And in addition to that, we need nurses to be more competent along with graduation. We don't need only nurses coming out with a diploma, bachelor's program, master's, and PhD. We want that competent people to take up that position. Not alone a graduation or a qualification is important to take a task. So we need people with more competency. So every time the competency level will be assessed, wherever you go for a job or wherever you take up a role, your competency plays a major role, and we always have many assessment in whichever area you move around. Your competency will be assessed, and you will be trying to be more competent. So, in this era of nursing, being competent and knowing about competency-based education is very, very important. Not only for us in our growth, it is also for the safe nursing practice and also to provide a quality care of nursing with the compassion. So in this session, you will be able to define competency, identify what are the types of incompetence, understand the background of competency-based education, recognize novice to expert model, elements of competency will be enlisted, illustrate the types of competency, and what is the need for competency-based education, practice evaluation of performance by Miller's pyramid and setting a SMART goal, differentiate traditional versus competency-based learning, appreciate what is the benefits of competency-based, and describe what competency-based is not, and also to list out the challenges of competency-based education. Definition. So what is competence? So it is defined as having the knowledge, skills, and ability required to perform the job. Competency. It is defined as the ability to perform the required skill in accordance to the established standards. Competency in nursing defines as the possessing the skill and ability required for lawful, safe, and effective professional practice without a direct supervision. So overall is competence, you should have an adequate knowledge, skill, and ability to perform a task without the direct supervision. As per American Association of Critical Nursing defines competency-based education as a system of instruction, assessment, feedback, self-reflection, and academic reporting that is based on students demonstrating that they have learned the knowledge, attitude, motivation, perception, skills expected of them as they progress in their educations. So overall, you could have understood from the definition, competency is not just a degree or a certificate. It is a skill which you are supposed to possess and knowledge and ability to perform a task. And competency in education, we have a system of instruction, we have set of assessments and feedbacks we have in the competency-based education, which we'll be seeing in the further slides. When you talk about competence, you also should know what is incompetence. Incompetence is a lack of ability to do something or the way it is supposed to be done. So we have spoken about the knowledge, skill, and attitude. So lacking any one of this component, we call it as incompetence. So she is incompetent to do that particular task. Maybe she lacks a knowledge or she lacks a skill in doing it. She has a knowledge and skill, but she lacks the ability to do it or the attitude, how she looks into that task. So we will see what are the types of incompetence. So incompetence, again, we have four classification. Unconscious incompetence, which means you are aware of the skill and you lack proficiency. You know how the skill has to be done, but you are not proficient in doing the task. Unconscious competence, performing the skills becomes automatic. So most of the nurses, all the previous nurses, they were all like that. You can see many nurses working in the clinics. So because they are automatic. They know every time when the doctor comes here or orders for a procedure, she knows by automatically, so this is supposed to be done. But she never knows what is the rationale behind it. So why it has to be done in that way. So that is unconscious competence. Conscious incompetence, you are aware of the skill, but not yet proficient. So you're conscious how it has to be done, but you're not proficient in doing. Conscious competence, you are able to use a skill, but only with effort. So you have a knowledge, you have a skill, and you know how you have the ability to do it, but you need an effort. Why we have to follow that rule? Why we have to follow that set standard? For example, if you want to give oral medications, you just pick up the tablet, you go and give it to a patient. But we have set protocols and standards how you have to proceed with the procedure. You have to check for the orders, you have to follow the 7 rights, you should not handle the medication on your bare hands. You have a medication cup, you have to explain to the patient, identify the patient again, and you have to administer it and make sure the patient swallows. So you have a set of standard. Only with an effort, when it is reinforced from the institution or somewhere, yeah, you have to follow the set standard, then it will be followed. That is conscious competence. So these are all the 4 types of incompetence. Then we will move on to the background of the competency-based education. Competency-based education emerged toward the end of 1960s, influenced by the educational objective taxonomy research of Benjamin S. Bloom and the work of Robert F. Magner on instructional objectives. Both sought to tie the skill students learn to application in the real-life setting. So one more thing is that competency-based education, we also call it as learning in a real-life setting. So we deal with the real patients and the learning happens in the real patient environment. And we also, for the competency-based education, there were 2 models which has been adopted. One is the novice to expert model, which was produced by Dr. Patricia Benner in 1982 to explain how an individual gains new skills and knowledge from novice stage to the expert stage. From novice stage, you have to cross the 5 stages to attain the expert. So this model has been incorporated into the competency-based education. And the one more model we will look up when we are looking into the performance evaluation, that is Miller's pyramid. So now we will look into the elements of competency as we have discussed about this in the definition. There are the 3 components which defines the competency and competency-based education. One is knowledge, the second part is skill, and the third part is attitude, or we call it as affective domain. Knowledge, ability to be aware of something. Skill, physical or motor ability to perform a task. Attitude, emotions, feelings, and how to approach about it. So these are all 3 elements. If lacking of any one of these elements, we call the person is incompetent. Types of competency. So when you look into the text, there are various types of competencies, types given. So generally we can classify into three competencies, and which we are also working with these competencies. And once you graduate and leave from the institute and go, you will come across these competencies very often in your clinical area when you practice your nursing. So the first one is the core or general competency, which includes the baseline skills required by the organization for all employers or students. Second one is a functional or unit specific competency, which includes the skill and behavior that are unique for each role. The third one is the leadership competencies, are often used for the supervision and the management related roles. So when we look into the core competency, so this is a general competency which includes all the baseline procedures. For anyone to be a nurse, either you work in the pediatric area, either you work in a psychiatry area, either you work in the cardiac, neuro, wherever you work, the basic general competency of the nursing is same. So that all will come under the general competency. And then the unit specific. So wherever the unit you are posted. So for example, you move on from you are working in a pediatric. So the competencies will be based on the pediatric procedure, whichever the unit you work. The competencies will be specific. So when you are going as working in the antenatal ward or a labor room or whichever the area, based on that, the competencies will be, you will be learning and to perform the skill or task in that unit. That is functional or unit specific competence. And leadership competency, usually these are the competence for the frontline nurses who is taking up the role of the supervision and management roles. So majorly we can classify the competency into core competency, functional and leadership competency. And this will be every time assessed. Wherever you go and take up a new job, a new placement, you will have a general competency. And wherever you move from one unit to the other unit, you will have a specific competencies. And wherever you take up a role of a managerial role, the leadership competencies will be taught to you, and you will be assessed based on your performance that you are competent or not competent. So you can stop me anytime if you have any doubt or you wanted to repeat the statements. And let us see what is the need for competency. Why do we need a competency-based education? Institution needs evidence for competency. You all know very well, we are in an era where we work with the evidences. So now we speak more about evidence-based practices. So whatever has been proven, that only we are following into our everyday practice. So same way, the education and competency also needs an evidences that you are competent or not. For second one, for the accrediting, regulatory or professional bodies needs an assurance. So all the regulatory bodies, yeah, we have recruited this staff or we have the students from this unit. So whether they are competent or not just completing the procedures, completing the practical hours and getting a certificate. So they need an assurance whether you're competent or not. So that needs a competency-based education. And also to measure the external standard as a measure for measuring the external standards. And quality needs a competency. And it also will give you an expected cost and time to achieve the expected goal. And hiring a new employee need competency for the entry level position. So whenever we hire a new person to a new role, so we make sure we need a person to be trained for, we give a probationary or an introduction period, orientation period for few months or days, depends on the policy of the institution, to make them competent to perform the role. So you need a competency. And for the professional and the personal development, and it is a valid and reliable assessment tool. And in competency-based education, we are using the adult learning principles, and it is relevant to the current practice and also for the licensure exams. So these are all the components which is needed for the competency-based education. And we can list out further and further, and these are the few key important points which I can list out why competency-based nursing is needed. Evaluating performance behavior. So in competency-based education, we also adopt a model I told you, that is Miller's pyramid, and we also evaluate the performance based on the SMART goals. So we will set goals based on the SMART mnemonic criteria. And in competency-based education, we get regular feedback for reinforcement, and we will discuss the improvement points, building effective and confident, competent manpower. And it also allows employees to take the ownership of the skills and behavior required for their roles. And it is a consistent and fair system of measurement for the evaluation, performance evaluation. So SMART goal, so you know very well what is SMART goal. SMART is specific. The objective what we set should meet this standards. Specific, and it should be measurable, and it should be action oriented. In your goals, you'll be writing down the specific steps you need to reach that success. That is action oriented, realistic, given by time and other constraint, whether you can reach the goal, it is achievable or not achievable, and time bound. Any goal should be a time bound. It should be achieved within this time period. So you have to set the outcome before you start with your competency based education. And most of the evaluations is based on the Miller's pyramid. So this is a Miller's pyramid where you can see the Bloom's taxonomy and novice to expert model, and also on the other end you can see how each criteria will be assessed on what kind of evaluations. So nowadays the evaluations, all we have a standardized evaluations. We are working on more and more with the more standardized performance evaluation tools are being used. So for the, if you know MCQ assessment based, and you have simulation, OSCE, which is very, very common kind of evaluation, we use in the competency based education, direct observation procedure skill, that is DOPS, and there is new one more skill, we call it as mini six. Okay, and workplace based assessment. These are all the some new standard evaluations which is coming up along with the competency based education. So this is one of the models which we incorporate for the evaluation of competency based education. So this is one of the LCWA clinical skill. This is one of a drive which is commonly now in practice for competency-based education programs, especially in the nursing. So I have just put a screenshot of the competency-based the screen, which we are practicing with our staff nurses and the students here. And this is a skill screenshot. So here you can see there is a home page. So I have discussed about the general competency, specific competency, and leadership. So based on the level of the trainees here, so we assign the competency. General will be assigned for all the staff, and specific till based on their unit, we assign the specific competency. So, and if you want to refer any competencies, you can just use the skill, and then you can enter, for example, IV therapy insertion or intravenous cannula insertion. You will open a page which will show you a quick sheet which gives you a brief description about the procedure or the content, whatever you are referring for. Extended sheet will give you little more in detail. And there is a video which shows a 3D videos where you can see the video for the insertion of any procedure, and that illustrations have tables, and this is a test option. So the person who is assigned for the competencies will go through the quick sheet and extended sheet. They will go through the content. They will opt for the test and submit, and supposed to score more than 80% of mark to pass the skill. And after doing the MCQ assessment and test, and checklist will be done. So the procedure will be demonstrated, and we make a checklist how the procedure is being carried on. And this is how the competency is assessed, and it is done every year. Annually, the competency is assigned for them every year to update themselves and to review their present knowledge. And also for the people who move from one unit to the other unit when they are cross training, because we need nowadays a more competent nurses who is capable of working in any area. Whenever there is a shortage in any area, it has to be covered. So we need a nurses to be competent. So we cover up nurses to work in all the area. We cross train them. So when there is a shortage, they will be ready to take up the role to perform the task. So for the cross training staff, the competencies will be assigned, and for the staff who joins newly, the competency is being assigned. And we also follow this competency from this year onwards for the postgraduate midwifery diploma students. because we organize certain modules for them as general and certain modules as their specific competency. So now we are following the competency for the student who is in the post graduation also. Into an nursing education, slowly we have to bring up the competency based education in forthcoming years. And the next, this is about the competency and what makes the difference between the traditional learning and the competency based learning. We will just watch a small video. So we have just watched a small video which show the differentiation between the traditional based learning and the competency based learning. So when we speak about competency based learning, it is a very vast topic and put up with a short frame is very difficult. So I just try to make up with in a short video to make you understand what is competency and what are the components, at least what is the need of competency and how it has been practically implemented and about the benefits and other things. So far, I hope you have an idea about what is competency-based education. So we will look on into the benefits. So benefits of competency-based education, it makes the student, it is a student center of learning and makes student more responsible. They take the ownership of learning and it improves the equity by serving the diverse learner and mitigates bias using the formative feedback and the feedback will be given from multiple assessors. The competency based education will not be from a single assessor and multiple methods are used. You will be using OSCE, you will be using the DOPS method, you will be using simulation method. So multiple methods of teaching can be used for competency based education and you will get multiple feedback from different assessors, which will help the students to relate the specific course and learning experience to the development of overall competencies. Clarifies the faculty expectation as we discussed. It makes the student more accountable for their learning. And it relates curriculum and course work to life and professional expectation and establishes in an objective way and promotes faculty development, which moves from the faculty role of teaching to coaching. So when we incorporate the competency based education, we move into the role of the coacher than teaching the students. And it creates a community of faculty with the common goals and expectation for student development and overall provides a cohesive framework for the course and the program design and development. So these are all the few benefits and it improves the quality of nursing education as we discussed in the needs because we need a quality assurance and we need an evidences and we need a valid and reliable tool to tell us the student whom we are bringing out is competent or the trainees we hold into practice are competent. So it improves the quality of nursing and it requires internal motivation and a collaborative culture and continuous cycle of assessment. So in competency based, you have not only the formative assessment and very often in the middle, you make frequent assessment will be done and the feedbacks will be given to improve the practice or improve the teaching and the learning process and also to assure the competence of a graduate. So these are all the few benefits of competency-based education. And what CB is not. So when I shown you a picture, we have told you about the checklist. Sometimes always the competency-based education is misinterpreted as only a checklist of tasks. Okay, so it is not a checklist of tasks and it is not a one and done experience of demonstration, or it is only isolated in one sphere of care or context. It is demonstrated, a demonstration not based on objective test. Competency based education, it includes the overall of the knowledge, skill and attitude. It's not just a checklist or a procedure which is demonstrated and you make and you observe a tick. And challenges. So we wanted to incorporate competency-based education into our nursing field. So when we incorporate the challenges, it changes our way of thinking, and we need a clear and specific language related to evaluation criteria, because the evaluation criteria, all it differs and it needs a training, and the coaches should need a clear idea about how it has to be carried on when you incorporate the competency-based education into the nursing practice. And you need a pilot testing, and working the glitches is very essential. So if you wanted to follow up with our education programs, we have to do a pilot testing before we implement the competency-based education. So, and we have to identify if there is a gap in the practice. Is there any gap which has a practical difficulties in following up the competency-based education? So these are all the three challenges which we will face when we wanted to implement a competency-based education into our curriculum. So just I have given an overview about competency-based education. Still, there is a vast lot of things to be learned about competency. So any doubts you have? So anybody wanted to share anything? Till the session, is it clear? Yes? Yeah. So just I'm concluding with the session. So just I will share in video an overview of what a competency is. Competency based education is, because competency, it is a very vast kind of things. When you wanted to practically implement, you should need a clear knowledge about how to proceed with that and what is the driver we can use, and we need the trained staffs for implementing the competency based education. And it is a more evidence based practice, and it will come in near future. We will incorporate into our everyday curriculum in our course patterns. So just we will have an overview of the video of the session. Any questions? So competency, now we are in a new emerging era where we need more competent nurses rather than having a mere degree, diploma, undergraduate, and doctorates. So we need a person, whatever, irrespective of the graduation they get it, we need competent based people to work and take up the roles. So that is what I wanted to emphasize. with this presentation to make it clear we are in an era of competency where we are supposed to be competent. And you have to prepare yourself to take up the roles in your future where you'll be keep on listening to this word competency. So any doubt, any questions from the audience? So anywhere you are not clear or you want to know more about it? Yes? Okay, if there is no question, then sorry, the moderator, if there is any question.
Anyone's having doubt or any want to ask any questions? Ma'am is here to give you to clarify.
Okay.
Is there any?
Thank you, ma'am.
Yeah. Yes,
For
yes.
giving-
I know it is a big topic when we speak about competency for as a beginner who is studying a nursing course. So, but you will at least have a basic idea, something you heard about competency, because in future you will be working on with that more and you will be remembering this session. So thank you for giving me this wonderful opportunity. I thank the principal and the institution for sharing this time precious moment with me. Thank you. Thank you.
Ma'am, sir want to ask one question, ma'am. Can you?
Yes, yes,
Yes.
yes, of course.
Ma'am, as we know that first you learn, then develop the skill, and competency comes by what traditionally we think. By doing, more you do the thing in whatever field you are, more competent you become. That is the common this thing in our क्या कहते हैं, what is this? What
Yes, I understand you, sir. So what you meant is without the traditional learning, there is no competency-based learning. Obviously, we have taken up, when I discussed about the models, so we have seen the Miller's pyramid. So it is step-by-step process. When you reach the level of expert, it is from knows how, and it is by step. You will be knowing it and then you will be practicing it under supervision, then without the supervision. So it is a step-by-step process. Once you will be told that you are competent for this procedure or you are competent to do this particular task.
Automatically someone, if he does something sincerely, then in the due course of time he become competent. Unconsciously he become competent. By day he improves in performing the
Yes.
job or doing the procedures, whatever it is.
Yes, you're right, sir, what you're telling. So that's what I discussed about the types of incompetence. So day by day they do it and they become expert. But in types of incompetence, I explain most of the incompetence. They should know what they are doing. Not even if you do every day, you do certain work, you know, you will do it correctly. You will do that specific task. Yes, I have to keep ready with this instrument. The doctor expects this one. You have to clean this, you have to inject that one, you will do. But the person who is doing the task should know what is the rationale behind it. So there comes the knowledge. So when you tell competence, it's not doing every day and he is getting practiced. Does he have the knowledge what he is doing? So that makes it. Only proficiency and skill will not be competent, including the knowledge. They should know what is happening. So that's why we have this competency-based education to give emphasis on all the three components. So you should have a knowledge. That's why I shown you an example of the clinical skills. Elsevier company, which is a drive which you are commonly using. So we give them the theory to make them understand what is the theoretical part, and then we will make them test whether they know it, and then we make a checklist to make them do and assess. And then we are observing them when they are doing with the real life patient without the supervision whether they are doing it correct or not. It is a step-by-step process, and we have to make sure all three components. It is not the matter of doing the task or not. Whether the person who is doing knows completely what he has to be, what for it has been done. Then only we can call them as competent. Only by doing and lacking a skill, and lacking an attitude or ability, we cannot conclude them he is competent.
Okay, thank you, ma'am, for an enlightening lecture. We are
And it is a
grateful.
very, yes, it is a very vast topic. When you talk about the performance evaluation and all, it goes on more and more. But this time constraint is very small to make you understand. I just wanted to make the student be aware. It's not just taking a degree home back or working in a place. The competency matters a lot. And we are working in an era of competency where you have to develop the skill later, not only now, later, even when you move out of your institutions, you have to keep on developing your knowledge and increasing your skill. So it is on every time you have to review your knowledge and skill. So this is what I wanted to emphasize to be more on with the knowledge, skill, and attitude. So you have to emphasize on all the three things to face this new emerging nursing area to fit with the new coming up practices. Okay, any more questions? Okay, thank you then. So I will stop with the session and thank you for giving me this opportunity.
Thank you, Ms. Gayatri.
So you enjoy the forthcoming session. Have a good day.
Hello. Thank you, Ms. Gayatri. I am Majida. Hello.
Hello, yes.
I'm Ajita. Thank you. Thank you
Yeah,
for your very nice lecture, and hope our delegates got adequate knowledge regarding competency-based education. And one request we are having is, and we listened to your lecture, but we did not saw you. So can you open your video for a while?
So yeah. 1 minute, please. I think I am there in the display.
Yeah. Okay.
Yes, okay. Okay, because I thought I will be distracting the session if I am in the middle of my session. Hopefully, good to meet you all and have a good session. And thank you, Ms. Sajita, for giving me this opportunity.
Thank you, guys. Thank you.
Thank you,
Thank you.
ma'am, for sharing your valuable ideas on competency-based education in nursing and sharing the contents and presenting the contents with many impressive, colorful slide and video. I'd like to express my gratitude and to appreciate you, ma'am, for giving us your valuable time. Thank you, ma'am. Now, I'd like to invite Ms. Simran Gupta, Clinical Instructor of Guru Shri Gorakhnath College of Nursing, for paper presentation.
Recording stopped.
A very good afternoon to chief guest and dear student. Myself Simran Gupta. I am here to present my research presentation. So my topic is satisfaction and coping strategies among cancer patients. So my problem statement is assess life satisfaction and coping strategies among cancer patients in a selected hospital at Gorakhpur. Life is 10%, what happened to us, and 90% how we react to it. It was given by Leslie Medley Russell. Introduction. Cancer does not affect just a patient body. It can also affect his, her mind, and many people will experience significant changes to their emotional health. Finding out you have a cancer can have a big impact on a person and their loved ones. And feeling of depression, anxiety, and fear are common. Patients in oncological care suffer variously due to underassessment of needs and suboptimal intervention, coupled with lack of access to oncological care. Need of study. Our aim is to explore the relationship between the coping strategies and satisfaction with life suffering from cancer. The present study shall try to identify the effective coping strategies which leads to satisfaction with life, even if one is afflicted with a chronic disease such as cancer. Objective: to assess the level of life satisfaction among samples, to assess the coping strategies used among samples, to find out association level of life satisfaction with selected demographic variable, to find out association between coping strategies with selective demographic variable. Research methodology, research approach. In this study, non-experimental, descriptive, quantitative research approach was used. Research design. In this study, descriptive research design was used. Sample size. In this study, 30 sample size were taken. Sample technique. In this study, convenient sample technique is used. Criteria of sample selection. Inclusion criteria. Patient receiving cancer oncological treatment. Patient age 30 years or older than 30 years. Patient who are present at the time of data collection. Has been diagnosed with patient in past year. Those who gave their consent. Exclusion criteria. Those who were not present at the time of the data collection. Patient with other psychiatric illness. Patient those who did not give consent. Description of tools. Section A. It involves demographic data of the sample such as age, sex, occupation, marital status, education qualification, and type of family. Section B. Coping orientation to problem experience inventory, that is brief cope. It is 28 items self-report questionnaire designed to measure self-effective and ineffective ways to cope up with stressful life events. Section C, that is temporal life satisfaction with life scale. This scale was developed by Paver, Denner, and Shu. That is 1998. It contains 15 items which were related with past, present, future, and satisfaction with life. Result demographic variable. Among 30 sample, majority of the sample, i.e. 56.66% were in the age of 50 years and above 36.67% were in the age of 40 to 49 years and 6.6% were in the age of group of 30 to 39 years. Among 30 sample, majority 63.33% of the sample were female and 36.67% of the sample were male. Among 30 samples, 40% of the sample were uneducated. That is 16.66% of the sample completed their higher secondary. 40% were educated and remaining 3.34% completely their post-graduation degree and above. That is the association between life satisfaction and selected demographic variable in the column from the demographic variable are the age, sex, education, qualification, occupation, marital status, and type of family. That is the chi-square value and degree of freedom, p-value, and interference are the significant. And next one are the association between coping strategies with selective demographic variable. In demographic variable, age, sex, education, qualification, marital status, and type of family, chi-square value, degree of freedom, and p-value and interference. That is significant. Chi-square value was calculated to find out the association between the coping score with their selected demographic variable. Significant association was found between coping strategies among cancer patients with their demographic variables such as age, sex, education, occupation, marital status. Evaluation of level of life satisfaction among samples. Among 30 samples, 50% of the sample had negative life satisfaction, 30% of sample have neutral life satisfaction and remaining 20% of sample had positive life satisfaction. This is the donut chart association between life satisfaction with selective demographic variable. And next is the association with coping strategies with selective demographic variable. Evaluation of coping strategies used among samples. Among 30 samples, 46.66% of the sample had inadequate level of coping, 36.67% of the sample had moderately adequate level of coping, and remaining 16.67% of the sample had adequate level of coping. Next is the association. Significant association was found between level of satisfaction among cancer patients with their demographic variables such as age, sex, occupation, marital status, and type of family. No significant association was found between level of life satisfaction among cancer patients with their demographic variables such as education qualification. Significant association was found between coping strategies among cancer patients with their demographic variables such as age, sex, education qualification, occupation, marital status, and type of family. Last is the conclusion. The study was aimed to assess life satisfaction and coping strategies among cancer patients in selected hospital at Gorakhpur. Non-experimental descriptive quantitative research approach was used to evaluate and find out between the coping strategies and level of life satisfaction. It was concluded that there was a significant association between coping strategies and level of life satisfaction with demographic variables. Thank you.
Now it's time for discussion.
What type of coping strategies you have seen?
Ma'am, I used coping strategies, ma'am. Brief cope, ma'am. That is a standardized scale.
Which you have assessed. Can you explain this scope?
Ma'am, in brief scope, 28 items are there. That is past, future related questionnaire are
Have you
there.
displayed this? You tool this tool you have?
Description tool in the
Yeah.
only short description.
Okay.
And next, the temporal life satisfaction scale. That is also a standardized scale.
Can you explain some points in that?
Ma'am, like, would you satisfy with life? Would you, ma'am, we are asking to the patient, like you are having any problem with that. Those patients who are having, ma'am, 30 years of age group, not satisfied with life, ma'am, according to this type of question in brief scope.
Some questionnaire which you have taken from the ready-made you have taken. So can you show this?
Question.
Because you are not giving anything in references that you consulted this book, this research paper or something. कोई book नहीं consult किया, कोई write up नहीं consult किया, कुछ भी नहीं किया. मतलब अपने आप पूरा सब किया कि कुछ consult किया.
सर consult किए.
तो वो reference में आना चाहिए सर. Whatever you, any study should be followed by ये last में उसका reference होना ही चाहिए. Whatever you have consulted.
Okay, sir. Sir, I just want to tell you, while like collecting the data samples, some patient not like 30 years of age group, uh, some patient are not satisfied with life. So I just want to tell you guys, life is so short. Stay happy and valuable of value of life. Thank you.
Thank you, Ms. Simran, for your good presentation. Now, I'd like to request Chairperson Dr. Alka Saxena, Ma'am, Principal College of Nursing, BRD Medical College, to speak few words on today's theme. Welcome you, ma'am.
देख लेना, चला लो, ऑन करो. Good afternoon to this beautiful hall, all the dignitaries and dear students, all the faculty members from this institute and outside colleges. And this is the time I think you are waiting for your lunch. Yes. So you just stand for 3 seconds and then sit down. So your circulation will be little bit, take some nutrition to your brain. Just stand up, then sit down. And take some few breath. Relax. I think now this is little bit better you feel. Okay. Take a few deep breath. In and out. Take some deep breath, at least 5. So since morning, we are studying so many things, many topics you have covered, and mostly the students, I think BSc nursing students, first year, second year, third year, fourth year, MSc nursing students, and DMLT paramedical students are in this hall. MSc students also, ANM, GNM, all the nursing programs. So we are talking about many good means very complicated things. Sometimes it is away from your mind, maybe because GNM, ANM, CBT, it is very just new terms for you. बहुत बड़े बड़े terms हैं, लेकिन since long if we see कि हम लोग इसको follow करते आ रहे हैं. अगर जैसे कॉम्पिटेंसी बेस्ड लर्निंग या टीचिंग के लिए बताया मैडम ने, आपने इतना सुंदर लेक्चर सुना उनका, तो हम लोग के घरों में क्या बोलते थे, तरीके से करो काम, ढंग से करो. मम्मी लोग भी कह देती हैं अरे काम ढंग से नहीं आता है. फिर तो क्या होता है ऐसे पढ़ाई में भी, और ऐसे जैसे जैसे हम लोग आगे बढ़ते जाते हैं तो हमारे में अभी क्या है कि एफिशिएंसी चाहिए. डिग्री तो है, अभी मार्केट में आप जाके देखो तो लोगों को हायर करने के लिए मिल नहीं रहे एफिशिएंट. डिग्री लेके बहुत लोग चल रहे हैं, डिग्री लेके जाते हैं, पता कंप्यूटर में बैठ जाओ, हमको ये वाला दिखाओ करके, तो काम नहीं आ रहा है. ऐसे ही हॉस्पिटल में चले जाओ, डोंट माइंड, ऐसा होता है कई बार कि हॉस्पिटल में चले जाओ, अभी ये प्रोसीजर करके दिखाओ, तो पता चला नहीं आ रहा है. डिग्री है, हायर डिग्री है, लेकिन काम उतना नहीं आ रहा है. तो कॉम्पिटेंसी बेस्ड नर्सिंग का जो कॉन्सेप्ट आया है, इधर नया नहीं है, देखो कब से चल रहा है, यहाँ पे इंडिया में भी आ गया, बहुत पुराना है. तो उसको कैसे हमें अपने लाइफ में लाना है और किस तरह से हम कॉम्पिटेंट बन जाए. और कॉम्पिटेंट का मतलब एक एस्पेक्ट नहीं है, आपका नॉलेज, आपकी एटीट्यूड, आपकी प्रैक्टिस, कोई भी काम करने में इन तीनों का एक कॉम्बिनेशन जरूरी है, तभी हम कॉम्पिटेंस बेस्ड नर्सिंग दे सकते हैं. चाहे कोई भी फील्ड हो, नर्सिंग का हो चाहे कोई भी फील्ड हो, उनमें कॉम्पिटेंसी चाहिए. कॉम्पिटेंसी का अभी जो हम लोगों ने वर्ड मीनिंग लिया, इसका मतलब क्या हुआ, कुछ समझ में आया, कोई बताएगा कॉम्पिटेंसी से क्या आपने अंडरस्टूड किया? योग्यता, एक काम के लिए योग्यता हो, एक उस तरह की शिक्षा मिले जो योग्य बनाए हमको. ओके, बहुत ज्यादा तो नहीं लूंगी, और आपका जो ये कॉम्बिनेशन है, मैं हिंदी बोल रही हूँ इसलिए कि मैक्सिमम मेरे को लगता है बहुत इंग्लिश हो गया सुबह से, तो थोड़ा मिक्स चलेगा, क्योंकि कई बार बहुत ज़्यादा इंग्लिश इधर से उधर निकल जाती है, तो आई थिंक इट इज ओके कि अदरवाइज आई हैव टू स्पीक इन इंग्लिश टोटली। मेक्स इट्स ओके। ओके, गुड। सो कॉम्पिटेंस आजकल देखो ना, मेडिकल की बुक और ये सब हिंदी में आ रही है, क्योंकि हमको अभी हिंदुस्तान में काम करना है, हिंदू हिंदू मतलब हिंदी लैंग्वेज में बात करना है, फिर जब अब्रॉड जाएंगे तब वो वाली लैंग्वेज साइड बाई चल ही रही है हमारी। ठीक है, अब हम लोग हिंदी की तरफ बढ़ रहे हैं फिर से। तो कॉम्पिटेंसी में जो हमारा एटीट्यूड, नॉलेज और स्किल, ये सारा एक कॉम्बिनेशन होगा, तब हम कहेंगे कि हम कॉम्पिटेंट है, योग्य है। ओके, एक हम क्षमता वाले हैं, एक प्रवीण है, हमें ज्ञान है, हमें कौशल है, और हम एक सिंपल अभी एग्जांपल आपने देखा कि आईवी इन्फ्यूजन भी अगर देना है तो हमें स्टेप बाय स्टेप उसमें परफेक्ट होना है। ये नहीं कि गए, सीखा नहीं था और हॉस्पिटल में गए, एनाटॉमी फिजियोलॉजी जो हम लोग के सब्जेक्ट से अच्छे से नहीं उस समय पढ़े, और मरीज के पास गए और बात करते करते इंजेक्शन लगा दिया, पता नहीं कहाँ लग गया, वो पता चला बाद में वो आ रहा लेके अपना, नर्व डैमेज हो गई। तो कॉम्पिटेंसी स्टेप बाय स्टेप पढ़ के जो हम कॉम्पिटेंट पर्सन बनेंगे, उसी को हम कॉम्पिटेंस बेस्ड लर्निंग में, अभी जैसे पहले वाला सिस्टम था, पहले हमने हमारे जो पुराने थे, जो जैसे बीए वगैरह करते थे कुछ उस समय में, तो बोलते थे 20 क्वेश्चन की एक की आती है, ठीक है, 5-7 दिन पहले वो खरीद ली और उसमें से 5 क्वेश्चन आ गए, 5 क्वेश्चन में से निकल गई, पास हो गए और डिग्री मिल गई। अब हो गया, एक ग्रेजुएशन हो गया। पहले होता था आज से 20-25 साल पहले, अभी तो बहुत चेंज आए हैं। अभी ऐसा नहीं है कि आपको कहीं से भी पूछा जा सकता है, कितना छोटा क्वेश्चन, अभी असेसमेंट प्रोसेस जो है बहुत मतलब एडवांस हो गया है। अभी आप देखो 2 सालों 3 सालों के अंदर इंडिया में अगर बात करें तो कंप्यूटराइजेशन कितना हुआ। आपका जो लैबों में ज्यादातर नर्सिंग कॉलेज में पहले कहीं लैब नहीं हुआ करती थी, सिमुलेशन लैब नहीं हुआ करती थी, कोई चेकलिस्ट नहीं हुआ करती थी, प्रोसीजर्स बस होते थे, वाइवा होता था और हो गया, पास हो गया, डिग्री मिल गई, लेकिन पता चला कि प्रोसीजर हुआ ही नहीं, आता ही नहीं था वो वाली चीज। ये बहुत रियल चीजें हैं जो हम लोग को हटाना है अपने नर्सिंग एजुकेशन में भी, और हमको एक कॉम्पिटेंट नर्सेस बनना है, जिसमें कि अभी देख रहे हो आप लोग डिमांड बहुत है। और अगर आप कॉम्पिटेंट नर्सेस नहीं है, सिर्फ डिग्री है, तो वो कोई भी फायदे की नहीं है, यूजफुल नहीं है। आपको स्टेप बाय स्टेप, आप बिगनर होते हो तब तो आपके एक्सक्यूज हो जाते हैं, भाई सीख रहे हैं, और जैसे जैसे अभी आपने भी एक पीछे देखा है प्रेजेंटेशन, जब आप बिगनर हो, नॉविस हो, तब तो चलेगा, अभी लर्निंग फेज में जब आप स्टेप बाय स्टेप चलते चलते जब आप एक स्मार्ट उसमें आ गए, बिल्कुल एक्सपर्ट हो गए, तब आपसे एक्सपेक्टेशंस रहेंगी कि आप एवरी फील्ड में यू मस्ट हैव, इन एवरी प्रोसीजर एंड एवरीथिंग यू हैव टू बी वेरी गुड। तो एक इसमें यही हो गया कि कॉम्पिटेंसी जो बेस्ड है, उसमें जो भी प्रोसीजर्स होंगे उसको इवेलुएट कैसे करते हैं, एक मेजरेबल होना चाहिए, कोई भी जो आपने बताया स्मार्ट, जो आपका असेसमेंट है, मान लो कोई भी प्रोसीजर आप चेक कर रहे हैं, देख रहे हैं स्टूडेंट्स का, ये मेनली जो प्लानिंग है ये टीचर्स के लेवल की है, इसलिए मैंने पूछा कि स्टूडेंट्स, ये प्लानिंग फॉर द टीचर्स है, टीचर कैसे उस प्लान को, उस कंटेंट को प्लान करें कि कॉम्पिटेंसी डेवलप हो पाए स्टूडेंट्स में। अभी स्टूडेंट्स कॉपरेट करेगा आपको, क्योंकि वो नॉविस है, ये टीचर लेवल की बात है कि कॉम्पिटेंसी बेस्ड टीचिंग को हम किस तरह से प्लान करें कि बच्चा जो है स्टूडेंट पढ़ के निकले वो कॉम्पिटेंट हो जाए। गेटिंग माय पॉइंट? आपको टीचर लेवल पे जो है आप किस तरह से, अब आप जैसे स्टूडेंट्स है, अब आप पेशेंट को आप केयर कर रहे हो, वहां पे हेल्थ एजुकेशन देने चाह रहे हो, तो आप किस तरह से प्लान करो। मान लो आप उसको इंसुलिन इंजेक्शन सिखा रहे हो, तो इंसुलिन इंजेक्शन लगाना किस तरह से एज ए स्टूडेंट, जब आप वहां पे सीखने के बाद जब आप उसको डेमोन्स्ट्रेट करोगे तो वो घर में जाके उसको प्रैक्टिस कर पाए। तो जो कॉम्पिटेंसी बेस्ड नर्सिंग का यही होता है कि एक तो लर्निंग ऑब्जेक्टिव्स के बेस होना चाहिए, करिकुलम जो इस तरह से डिजाइन किया जाता है कि वो टाइमली हो और उसको जो है फीडबैक मिल सके। तो कॉम्पिटेंसी बेस्ड एजुकेशन का मतलब यही है कि आपका जो आप उन बच्चों को सिखाएं तो वो आपको पूरा करे, पहले रट्टा जैसा नहीं चलेगा, रोट रोट लर्निंग हुआ करती थी, है ना, जब हम लोग भी एग्जाम देते थे, हमारे सर इससे होंगे, एग्री करेंगे कि जैसे जब कॉपी मिलती थी और हमारा भी 2 ही पेज नहीं लिखा पाए और तीसरा जो हमारा क्लासमेट है उसकी 5, उसका लास्ट पेज होगा, सर कॉपी मैडम कॉपी, तो वैसे ही हार्ट बीट बढ़ जाती थी। और टीचर भी तौल लेते थे, अच्छा इसकी दो कॉपी है सप्लीमेंट्री, इसके नंबर इससे ज्यादा लिखा होगा, भले उसने इतना इतना छोड़ के मिला। अभी इसीलिए यूनिवर्सिटी ने कम कर दिया। यूनिवर्सिटी ने क्या किया, एक कॉपी मिलेगी, एक कॉपी में तुम्हें जो लिखना है लिखो, चाहे अच्छा लिखो चाहे बुरा लिखो, एक कॉपी मिलती थी। हमारे जमाने में सप्लीमेंट्रीज बहुत मिल जाती थी, तो लिखते थे। तो पता चला कि जो अच्छा लिखने वाला होता था, जिसने कंसाइज वे में अच्छा टू द पॉइंट लिखा होता था, उसके नंबर तो आ गए, और जिसने 25 कॉपियां भरी है वो टेंशन दे दे के बस उसने खराब किया काम, उसके नंबर कम आए। तो रट्टा वाला था। हमारी एक बैचमेट थी, वो 1 to 1 जो रट, जब वो क्लास में हम लोग डिस्कशन करते थे एग्जामिनेशन के समय, तो ऐसा सुनाती थी जैसे पढ़ रही हो, इतना उसको रट्टा रट लेती थी चीजें, उतना मेमोराइज कर लेती थी। हमने तो इसको सब याद है, आधा टेंशन वही दे देती थी एग्जामिनेशन हॉल में जाने से पहले। तो इतना पहले मेमोरी पे देखो, बादाम खिलाए जाते थे पुराने टाइम में कि खाओ, मेमोरी बढ़ जाए, मेमोरी शार्प हो जाए। तो पहले जो बहुत पहले लर्निंग जो हुआ करती थी, कितना रटा हुआ है। बच्चों को हम लोग बोलते थे सीखो आओ, ये सुनाओ, पोएम सुनाओ, ये सुनाओ, बच्चा फट 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 सुनाता था। तो उसको मीनिंग नहीं पता था। अभी 3-4 साल के बच्चे से पूछो, उसको नहीं आएगा गाने पे ये वो सब मीनिंग नहीं पता, लेकिन वो रट लिया उसने। तो अब ये जो लर्निंग है वो शिफ्ट हो गई है, टीचिंग भी शिफ्ट हो गई, लर्निंग, टीचर का काम टीचिंग, बच्चे का काम, स्टूडेंट का काम लर्निंग है। तो ये टीचिंग को भी अडॉप्ट करना पड़ेगा इस मेथड को, और लर्नर को भी अडॉप्ट करना पड़ेगा। वो रट्टा वाला सिस्टम खत्म करके अब ये शिफ्ट हो गया है लर्निंग, जो कहाँ पे हो गई है, ये शिफ्ट होने के बाद जो है लर्नर की तरफ शिफ्ट हो गई है। ठीक है, अब रटना नहीं है, अब कॉम्पिटेंसीज डेवलप करनी है। कॉम्पिटेंसी भी हमने बताया आपको कि नॉलेज, स्किल और एटीट्यूड तीनों का कॉम्बिनेशन है। नॉलेज आपकी अच्छी हो जाए, ज्ञान जिसको बोलेंगे, एटीट्यूड मतलब आपकी फीलिंग, मरीज को केयर करना है तो मन ही नहीं है, नॉलेज तो है, अच्छे से आती है केयर करने के लिए, कैंसर पेशेंट का केयर करना है, लेकिन नॉलेज सब है, ये होता है, लेकिन एटीट्यूड, अरे क्या करेंगे जाके, पेशेंट दर्द में हो रहा है, अरे बहुत दर्द वाले आते हैं, तो एटीट्यूड ही नहीं है। स्किल भी है लेकिन मन नहीं है। तो तीनों चीजों का कहते हैं हेड, हार्ट एंड और हैंड्स, तीनों, ब्रेन है ना, हेड, हार्ट एंड हैंड्स, ये तीनों का कॉम्बिनेशन मिला के ही जब होता है तब कॉम्पिटेंसी बेस्ड नर्सिंग आती, क्रिटिकल थिंकिंग में। एनपी इन जो 2020 आया, नेशनल पॉलिसी ऑफ एजुकेशन, इसमें यही बताया गया कि कॉम्पिटेंसी बेस्ड में जो टीचिंग होगी, इसमें सिलेक्शन ऑफ सब्जेक्ट शुड बी फ्लेक्सिबल, फ्लेक्सिबिलिटी है। अभी आप देखो जो नया आया है, इसमें बताया कि कोई इतना करके मिल जाएगा तो इतना, उसको फर्स्ट ईयर कर लिया, इतना मिल गया, फिर बाद में देखेंगे, तो फ्लेक्सिबिलिटी कर दी है कोर्स में। फिर कई सारे देखो, अभी सीबीएसई वगैरह में जो कई सारे यूनिट्स हटा दी गई, कुछ जोड़ दी गई, जो काम की नहीं थी वो हटा दी गई, फिजिक्स वगैरह में, तो जो जरूरी नहीं थी वो हटाई गई और कुछ ऐड ऑन की गई। फिर एथिकल एंड मॉरल रीजनिंग हो, इसका मतलब ये कि व्हेन सीबीए जब आप पढ़ रहे हो कॉम्पिटेंसी बेस में, तो इसका पर्पस यही है कि एथिकल एंड मॉरल रीजनिंग जो भी हम सीखें उसको हमने सिर्फ अपने पास तक नहीं, हमें नॉलेज नहीं होना, नो नहीं करना, जानना नहीं है, उसको अप्लाई करना है। आज हमने क्लासरूम में जो सीख लिया है उसको हमें अप्लाई करना है, और हमारे उसको रिलेट करना है अपनी लाइफ से, उसको किस तरह से प्रैक्टिकली सिचुएशन में जब पढ़ जाओ। अभी डिजास्टर मैनेजमेंट आपने थ्योरी पढ़ लिया, अब सच में कहीं भूकंप आया तो भगोगे, समझ ही नहीं आएगा क्या करना, आग लग गई क्या करेंगे, तो उसको प्रैक्टिकली उसको किस तरह से इम्प्लीमेंट करना है, ये है, इसको कॉम्पिटेंसी बेस एजुकेशन बोलेंगे। जेंडर सेंसिटिविटी, सिटीजनशिप अच्छा बनना, साइंटिफिक टेम्पर होना चाहिए, लैंग्वेज प्रोफिशिएंसी भी बहुत जरूरी है, क्रिएटिव एंड इनोवेटिव, आर्ट एंड एस्थेटिक डेवलपर, मतलब पूरा एक ओवरऑल जो निकले स्टूडेंट जब पढ़ के इस मेथड को अप्लाई करके, तो उसमें सिर्फ ये नहीं कि नॉलेज है, सिर्फ साइंटिफिक खाली एक सब्जेक्ट पता है, उसको ओवरऑल उसका जो है डेवलपमेंट जरूरी है। हेल्थ एंड न्यूट्रिशन एंड फिटनेस, मैथमेटिकल थिंकिंग, डेटा साइंस, आर्टिफिशियल इंटेलिजेंस, मशीन लर्निंग, तो ये सारा कुछ इसमें आएगा। ओके, क्लियर। देन शिफ्ट इन द फोकस ऑफ असेसमेंट, तो इसमें पहले टेक्स्ट बुक हो गया, टेक्स्ट बुक से पढ़ लिया, अभी बहुत सारी चीजें आप देखते हो कंप्यूटर में, आप ये जो इंस्ट्रक्शंस हैं, कंप्यूटराइज इंस्ट्रक्शन मॉड्यूल्स, एआई वगैरह है, इससे भी आप अपना लर्न कर सकते हो। अभी देखो इंटर्नशिप का कितना वैल्यू हो गई है, अब गवर्नमेंट भी इंटर्नशिप के लिए फ्री करा हुआ है स्टूडेंट्स को। पहले इंटर्नशिप के लिए घूमते रहते थे बच्चे, अभी इंटर्नशिप के लिए बाकायदा एक उनको पेमेंट भी मिल जाता है, इंटर्नशिप चार्जेस भी मिल जाते हैं। तो प्रैक्टिस बेस्ड इंटर्नशिप आई, जिससे कि कॉम्पिटेंसी, मार्केट में वो डिग्री लेके नहीं घूमे, उसको फटाफट जॉब मिल जाए। हाई क्वालिटी बाईलिंगुअल, हाई मतलब बाईलिंगुअल लैंग्वेज मतलब होना चाहिए, जैसे मदर टंग है प्लस इंग्लिश, उसको कॉन्सेप्ट क्लियर करे तो वो इंग्लिश में जूझता रह जाता है किताबों को मोटी मोटी लेकर के, उसको समझ में आए कि भाई लिखा क्या है। आधा समय अब देखो कहीं बाहर मेडिकल करने जाते हैं, रशिया में कहीं भी जाते तो उनको पहले, चाहे इंडिया का जाए बच्चा तो कहीं पे भी पहले वो लैंग्वेज सिखाते हैं। ओके, हमारे यहाँ हिंदी पढ़ता पढ़ता बच्चा आया और उसको आया तो इंग्लिश की बहुत सारी, जो हिंदी मीडियम के बच्चे उनकी बात कर रही हूँ, पता चला इतनी मोटी मोटी किताबों की तो 6 महीने तो उनको समझ ही नहीं आता क्या है ये, है ना। तो बहुत चीज है कि ये जो भी मैटर कंटेंट है वो बाइलिंगुअल होना चाहिए, मदर टंग प्लस इंग्लिश। क्वालिटी जो है टीचिंग और लर्निंग मैनुअल्स जो बन के आ गए वो यूज करिए। तो बहुत सारी इसमें चीजें हैं जो आप लोग कर सकते हो। फिर क्या टूल है, किस तरह से आप असेसमेंट कर सकते हो इस बेस में, तो थॉरो रूब्रिक्स, पोर्टफोलियो, जैसे कि आप खाली नॉलेज बेस पे ना उसका असेसमेंट करो कि भाई इतना नंबर इतना स्कोर कर लिया उसका हो गया, वो और भी काम करता है। जैसे कि मान लीजिए कोई पार्टिसिपेट गेम में कर रहा है, कोई अदर एक्टिविटीज में इन्वॉल्व हो रहा है, तो उन सब की ओवरऑल उसका मार्किंग को देखना है, सिर्फ एक ही चीज में नहीं कि कॉम्पिटेंट है एक ही सब्जेक्ट में एक ही एरिया में। कॉम्पिटेंट का मतलब ऐसी सिचुएशन आए तो वो कोप अप करके निकल जाए उस चीज को। तो कॉम्पिटेंसी का मतलब वो है कि सारी चीजें उस तरह से प्रोजेक्ट मेथड में, टेस्ट में, असाइनमेंट, इन सब में भी उसका पूरा असेसमेंट किया जा सकता है। देन बहुत सारी चीजें इसमें और भी हैं, अब इतना टाइम नहीं है सबको, टाइमिंग की मेरे को लग रहा है अभी फिर से डाउन हो गए, ज्यादा हो रहा है कुछ, है ना। तो इसमें बस थोड़ा सा एक बात बताऊंगी कि ये जो बेस्ड लर्निंग है, कॉम्पिटेंसी बेस्ड लर्निंग, ये एक्सपेरिंशियल मेथड मतलब एक्सपीरियंस करके है, एक्सपेरिमेंटल मेथड से करना है। लर्निंग बाय डूइंग, आप रेसिपी पढ़ लो, बनाने चलोगे तो नहीं बना पाओगे। तो लर्निंग बाय डूइंग, आप काम करके सीखोगे, चेकलिस्ट के थ्रू करोगे। अभी आपके यहाँ मैडम ने, अजीता मैम ने बहुत बढ़िया लैब बनाया हुआ है, सिमुलेशन लैब, जाते हो उसमें, देखते हो ना, उसमें एक चेकलिस्ट भी मिली हुई है, उस चेकलिस्ट के थ्रू जब आप गो थ्रू होते हो ना, तब आपको पता है ये चीज हमारे 10 में से हमको कितने % हमने सही किया। तो उसको पहले प्रैक्टिस करते करते चलो, ट्रायल एंड एरर वाला नहीं कि हॉस्पिटल में गए और आधी गलतियां कर दी, कोई भी प्रोसीजर के 10 पॉइंट्स हैं तो आपने 5 गलत कर दिए, यही प्रैक्टिस करो। इंडिया में तो चल जाता है कि जाके पहली बार गए और इंजेक्शन पकड़ लिया, फॉरेन कंट्री में आप नहीं अलाउ करते। इवन यहाँ इंडिया के जो गवर्नमेंट जो प्राइवेट हॉस्पिटल अच्छे वाले बहुत है, वहां पैसे नहीं जाके पेशेंट को टच कर सकते हो जब तक आप उसमें एक्सपर्ट नहीं हो। ओके, बाकी काम करवा लेंगे लेकिन पेशेंट को नहीं टच करने के, इंजेक्शन लगा दो अभी एक, जब तक आप उसमें कॉम्पिटेंट नहीं है। तो ये लैब मेथड्स में, प्रोजेक्ट मेथड से, फील्ड ट्रिप से, फील्ड विजिट ले जाके भी बहुत सारी चीजें कॉम्पिटेंट बनाया जा सकता है। मान लीजिए वाटर प्यूरिफिकेशन देखना है, मिल्क का प्यूरिफिकेशन देखना है, मिल्क का जो अपना देखते हो, तो आप कहाँ देखेंगे, जब वहाँ पर्टिकुलर डिपार्टमेंट में जाके आप विजिट करोगे, तब आपको समझ में आएगा कि किस तरह से काम होता है। बुक से पढ़ने से उतना नहीं आएगा, जब ये सब चीजों को मिला करके आप टीचिंग मेथड अडॉप्ट करोगे, देन यू विल अंडरस्टैंड। तो जॉन डेवी का यही था कि जीवन के साथ चीजों को जोड़ना है, क्या क्यों हो रहा है, जब अपने साथ जो भी हम सीख रहे हैं उसको जीवन के साथ जोड़ के अपनी स्टडी करना चाहिए, और आप क्यों कर रहे हो जानना भी है, और उसकी अपने को रिलेट करना है आपके लाइफ एक्सपीरियंस से। ये सारे रियल होते हैं, लाइव बेस्ड होते हैं, प्रिसाइज एंड मेजरेबल होते हैं, जो लर्निंग आउटकम निकलेंगे, क्योंकि मेजरेबल है, जो भी हमने सीखा वो हमारा को कोई जज कर रहा है। ओके, तो मैं ज्यादा अब इसमें नहीं करूंगी, तो अपना यही है कॉन्सेप्ट कि जब हम लोग इस चीज को कर रहे हैं तो हमको पूरा परफेक्टली करना है, और जब हम मार्केट में आपको जॉब के लिए कहीं पे भी अप्लाई करें जाके, आपको जो लॉग बुक मिलती है, प्रैक्टिकली जो लॉग बुक में प्रोसीजर्स होते हैं, आप फिर से करो। जब 4 साल से निकलने से पहले होता है, मान लो कुछ चीज छूट गया, आप निकलने से पहले उस चीज को करके देखो, अपने टीचर्स को दिखाओ, आप एक एक प्रोसीजर में परफेक्ट हो जाओ, तभी आप जाओगे, तब आप क्वालिटी केयर दे पाओगे। क्रिटिकल जो भी केयर होती है आप उसको उस हिसाब से मैनेज कर पाओगे मरीजों को, क्वालिटी नर्सिंग केयर के ऊपर बहुत बात होती है। तो जब हम परफेक्ट होंगे, एफिशिएंट होंगे, हमारे को सारा चीज क्लियर होगा, तभी हम एक अच्छा कॉम्पिटेंट बेस्ड नर्सिंग का भी जो कॉन्सेप्ट आया उसको जस्टिफाई कर पाएंगे। तो ये टीचर्स के लिए भी था और स्टूडेंट्स के लिए भी। जैसे मैडम ने बताया, इट्स वेरी बिग टॉपिक, तो टाइम ज़्यादा चाहिए होगा, लेकिन टाइम इज वेरी शॉर्ट नाउ। सो थैंक यू सो मच मैडम डॉक्टर अजीता मैम। for giving me this opportunity to speak in front of you. And thank you all the students for patience learning, means patiently listening the things. And all of you, thank you management and all the faculty, those who have arranged this international workshop. Thank you so much.
Thank you, ma'am, for sharing the valuable ideas on the theme. And I'd like to express my gratitude to appreciate you to giving us your valuable time. Thank you, ma'am. Now, I'd like to invite Dr. Rajendra Bharti sir, Dean Administration of Guru Shri Gorakhnath University, to honor our chairperson, Dr. Alka Saxena ma'am.